Students, before you even start preparing for the NCLEX, I want you to understand something most first-timers never realize. This exam doesn't test how much you can memorize. It tests how well you can think, act, and apply safe nursing care in real-life emergencies. Passing isn't about scoring high overall. It's about performing above passing standard in each of the 15 must-tested categories. Even if you do well in 14, one weak category can prevent you from passing. Let me tell you a story about Liam, a first-time NCLEX student. When he started studying, he thought memorization alone would carry him through. He learned lab values, medications, disease definitions, but he never practiced applying this knowledge to real patient scenarios. He was confident, thinking he knew everything. On exam day, he quickly realized that the NCLEX measures ability, not memory. He faced questions that required him to recognize life-threatening emergencies across all body systems, prioritize interventions, and respond safely. He struggled. He couldn't consistently identify the patient with acute decompensated heart failure, or notice the subtle signs of a pulmonary embolism, or recognize that a patient with increased intracranial pressure needed immediate intervention. The NCLEX doesn't care that Liam could recite the textbook. It cares whether he could apply knowledge safely to save a life. That's what passing at above passing standard means. Let's walk through some of these emergencies so you understand why mastering this category, physiological adaptation, is non-negotiable. Imagine you're caring for multiple patients, each with an emergency in a different system. In the cardiovascular system, you may encounter patients with heart failure, pulmonary edema, myocardial infarction, cardiogenic or hypovolemic shock, arrhythmias like ventricular fibrillation or bradycardia, cardiac tamponade, hypertensive crisis, or acute pericarditis. Each requires rapid assessment, prioritization, and immediate intervention. One missed cue could be fatal. In the respiratory system, emergencies like status asthmaticus, pulmonary embolism, pneumothorax, ARDS, COPD exacerbation, respiratory failure, pulmonary edema, or anaphylaxis demand precise knowledge of airway management, oxygen therapy, and rapid escalation of care. In the neurological system, patients may present with stroke, seizures, increased intracranial pressure, spinal cord injuries causing autonomic dysreflexia, meningitis, brain herniation, traumatic brain injury, or acute migraines with deficits. Recognizing subtle neurological changes early is critical to prevent permanent damage or death. The gastrointestinal system can suddenly turn dangerous with bowel obstruction, peritonitis, gastrointestinal perforation, GI bleeding, acute pancreatitis, ruptured appendicitis, hepatic failure, or toxic megacolon. Each of these requires swift identification and prioritization, because complications can progress in minutes. Endocrine emergencies are equally critical. Diabetic ketoacidosis, hyperosmolar hyperglycemic state, thyroid storm, myxedema coma, adrenal crisis, pheochromocytoma crisis, and severe hypoglycemia can all lead to rapid deterioration if not identified and managed immediately. The integumentary system is not just skin deep. Severe burns, Stevens-Johnson syndrome, toxic epidermal necrolysis, necrotizing fasciitis, infected pressure ulcers, and acute allergic dermatitis can trigger systemic complications, sepsis, or multi-organ failure. In the genitourinary system, emergencies include acute kidney injury, urinary retention, obstructive uropathy, acute glomerulonephritis, renal failure, and complications of urinary tract obstruction. Electrolyte imbalances or fluid overload here can quickly become life-threatening. The musculoskeletal system also has hidden crises. Compartment syndrome, crush injuries, acute fractures with neurovascular compromise, dislocations causing vascular compromise, and severe osteomyelitis. Rapid recognition and intervention prevent permanent disability or death. In maternity, the stakes are double: preeclampsia, eclampsia, postpartum hemorrhage, placental abruption, amniotic fluid embolism, and shoulder dystocia can threaten both mother and baby. Immediate, skilled intervention saves lives. The immune and lymphatic system, especially in oncology, poses emergencies like neutropenic fever, tumor lysis syndrome, sepsis in immunocompromised patients, severe allergic reactions, and hyperviscosity syndrome. Immunocompromised patients deteriorate quickly, so rapid action is essential. The hematologic system includes disseminated intravascular coagulation, sickle cell crisis, acute anemia, thrombocytopenia with severe bleeding, and acute leukemia complications. Here, even minor delays can escalate into shock, stroke, or death. Sensory system emergencies involve acute angle closure glaucoma, retinal detachment, sudden hearing loss, orbital cellulitis, and acute otitis media with complications. These can cause permanent disability if not recognized and treated promptly. Finally, mental health emergencies must never be underestimated. Neuroleptic malignant syndrome, psychosis with risk of harm, severe depression with suicidality, acute mania, severe anxiety or panic attacks, and delirium can all escalate to life-threatening situations without immediate intervention. This is the reality of physiological adaptation on the NCLEX. Liam learned the hard way that knowing facts is not enough. He realized he had to practice recognizing cues, analyzing them, prioritizing patients, generating safe solutions, taking correct actions, evaluating outcomes, and applying clinical judgment. The then Liam was overwhelmed, unsure, and underprepared. The now Liam is confident. He can assess every patient system, recognize which emergency needs immediate attention, act safely, and evaluate outcomes effectively. He knows that achieving above passing standard in physiological adaptation is essential, because this category forms the foundation for handling emergencies in all other NCLEX categories. So, beginners, your takeaway is clear. The NCLEX rewards safe, competent action across all emergencies in every body system. Study each system thoroughly, practice with scenarios, and visualize emergencies daily. Your goal is not to just pass, it's to master physiological adaptation at above passing standard so you can confidently handle any patient crisis. The journey may seem long, but this is how you prepare to pass the NCLEX at once, transforming from a nervous beginner into a capable, confident nurse ready for real-world patient care. Watch closely, practice consistently, and build your competence one category at a time.